I'd like to give a short example of a My Brain Shark presentation, and the topic is the same one that we looked at in the lesson, which is about metabolic syndrome. And I want to just discuss three things: causes, problems and cures connected with metabolic syndrome. So my presentation is divided into three main parts, which consist of three questions. The first one is, what causes metabolic syndrome? The second one is, if somebody has metabolic syndrome, then what problems can happen to them? And finally, I'd like to look at different ways in which somebody with metabolic syndrome can cure it, or to put it another way, can recover from the disease. Before I look at those three questions, I'd just like to say why I'm interested in the topic. And I guess the main reason is that as I get older, I've been having regular checkups, as you can see from the example in the picture. And each year, I think the nurse that checks my waist has commented that my waist is gradually increasing, and so I think it is an issue for me personally, that I'd like to know a little bit more about what metabolic syndrome is and how to recover from it. As you can see from this Padlet example, the class had a lot of wonderful ideas after you did some research about what metabolic syndrome is, and you posted them. And basically it seems that the main way in which you can identify that you have metabolic syndrome is the size of your waist. And it seems that for women around about 89 centimeters is an indication of metabolic syndrome, and for men about 101 centimeters. It seems that there are a number of problems that can result from being overweight and having metabolic syndrome. Probably the most common are the four here that I have picked out. They may all be connected actually. So a patient may have a combination of these, but high blood pressure seems to be very common, and that may lead to things like heart disease or strokes. And diabetes is also a common problem connected to metabolic syndrome. So what can somebody do if they have metabolic syndrome? Well, it seems the answer is a little bit obvious, but lead a healthy life. And I've just given four examples here. One of them is to eat lots of fruit and vegetables and fiber, and to not eat so many fatty foods such as hamburgers or other kinds of junk food. It's important to try and get as much exercise as possible, and to lead an active and healthy lifestyle. Smoking may be a factor, so if a patient can stop smoking or decrease their smoking, that would be very helpful. So just to sum up with a few final thoughts, metabolic syndrome is probably a very modern disease, a result of modern lifestyles where people are not active enough and eat too many fatty foods, and maybe are overstressed and smoke too much. But it's a complex disease, and there are many factors that intertwine. It seems the main thing to do to cure it is to get back to basics, to live a life of moderation, not eat too many fatty things, and to lead an active and healthy lifestyle. And I hope that everybody in the class can certainly do that in the future.